What is pembrolizumab or Keytruda? How does it work? And which patients are eligible for this treatment? In this video, I'm going to answer all of those questions. I'd first like to invite you to subscribe to our channel. We're always putting out new content, so there's always something new to watch. So perhaps you've heard of immunotherapy. We have another video on immunotherapy. Pembrolizumab, the brand name of which is Keytruda, is one such type of therapy. Unlike chemotherapy, which kills cells, pembrolizumab and other immunotherapies help your body recognize the cancer cells as foreign and helps, along with chemotherapy, kill those cancer cells. So pembrolizumab is a specific immunotherapy, and it works by basically unmasking cancer cells. Cancer cells that have a protein called PD-L1 can sort of hide from the immune system. Pembrolizumab blocks PD-L1, exposing the cancer cells to your immune system. We generally don't use immunotherapy all on its own. Immunotherapy is combined with chemotherapy to both directly kill the cancer cells and to unmask or unblock those cancer cells from the immune system, making them vulnerable to both types of treatment. So who is pembrolizumab or Keytruda used in? What type of patients might hear about pembrolizumab? Well, the use of this drug is confined only to people with triple-negative breast cancer. We have a lot of videos on triple-negative breast cancer, but in brief, triple-negative cancers is a term we use to describe cancer that is negative for the estrogen receptor, negative for the progesterone receptor, and negative for the HER2 protein or the HER2 oncogene. So all three of these markers are negative, making it triple negative. Pembrolizumab is used with chemotherapy before surgery and is effective in decreasing the amount of cancer that's seen at the time of surgery. So perhaps you've heard of primary systemic or neoadjuvant therapy. This is treatment given before surgery. And when pembrolizumab is used along with chemotherapy, it's more effective than chemotherapy alone at killing all of the cancer in the breast. Then the person would go to surgery, and then we look under the microscope and we see how much cancer is left. People who got chemotherapy and pembrolizumab, sometimes we call it Pembro for short, have less cancer when they have their surgery. The other type of people this is used for is people who have all their chemotherapy first and then have surgery, and we see more cancer. Pembrolizumab can be given both before surgery and after surgery. And finally, it's used in people with metastatic breast cancer, that is, cancer that's spread to other parts of the body. Again, that's triple negative and used most commonly with chemotherapy. The Keynote 355 trial was done in people with metastatic cancer, and when combined with chemotherapy, improved survival in people with metastatic breast cancer. Interestingly enough, when given before surgery or after surgery to people without metastatic disease, and I find this fascinating, the PD-L1 status of the tumor did not predict whether they benefited from pembrolizumab or not. So in metastatic disease, the treatment is used in people where the tumor has PD-L1. In earlier stage disease, whether the tumor had PD-L1 or not, pembrolizumab improved the response to chemotherapy and was used after surgery and improved outcomes. So it's really interesting. They're really almost two different scenarios entirely. How is it given? Pembrolizumab is given by intravenous infusion. It takes 30 to 60 minutes to deliver the medication. For people getting pembrolizumab before surgery and after surgery, it's given for a few weeks to months and then given for a few months thereafter. For people with metastatic disease, we tend to give it as long as it's tolerated, as long as people are managing and feeling okay. Once they're not, if the side effects accumulate or are too severe, the treatment is stopped. It can always be reintroduced. But remember, in metastatic disease, our goal is to improve survival, but it needs to be a good quality of life. In earlier stage disease, we're more willing, patients and treatment teams are more willing to cause side effects because we're improving survival. In people with metastatic disease, the ultimate goal is to help you feel better and prolong survival. So we have to be really careful in terms of, are we meeting our goals of care? I hope that distinction is clear. What about the common and serious side effects? The side effects are very different from chemotherapy. With immunotherapy, we worry about inflammation of the lung, the thyroid, the liver, all sorts of inflammatory side effects as opposed to toxic side effects. Now, they can be very serious. So, dermatitis, inflammation of the skin, is a common side effect of all immunotherapy. If it's a mild rash, things can continue as they are. If the rash becomes severe, we have to hold immunotherapy, and we'll often use corticosteroids to settle down the inflammation, whether it's in the skin or the liver or the lung. More mild side effects are fatigue, itching, as I mentioned, nausea and diarrhea. Again, those are more common and more easily managed. The more serious side effects are the ones where we see organ inflammation that can be everything from the thyroid to the lungs to the liver, and you'll be monitored very closely to make sure those side effects are being caught early should they arise. So let me just recap. Pembrolizumab, the brand name of which is Keytruda, is used to treat triple-negative people with triple-negative breast cancer, early stage disease that's considered high risk, or metastatic disease only in triple negative cancer. It's given intravenously every few weeks over a short infusion. Monitoring for side effects is really important. If you've been on pembrolizumab, Keytruda, and you have a comment you'd like to share with the Yerbba community, please feel free to drop it below. Thank you as always for watching, and we'll see you next time.